You finally got your Medicare all set up and you breathe a sigh of relief, then wham, a slew of denied Medicare claims flood your mailbox. Medicare mistakes sometimes happen, and in this video, I'm going to show you how to avoid them. Here's an example of one that we stepped in to fix for one of our clients. So our client received bills for more than $1,500 in unexpected charges. He had changed his drug plan during the annual election period for a new Part D drug plan that would save him about $500 the next year on his prescription drugs. Once we investigated the denials, we learned that he had used his new Part D drug plan card when purchasing replacement parts for his CPAP machine. All of the bills were denied, of course, because Part D doesn't cover durable medical equipment. Medical equipment falls under Medicare Part B and would have been covered entirely by Medicare in his supplement if he had presented the right insurance card. Now he was facing multiple unpaid bills and needed help figuring out where to begin to fix his mistake. Fortunately, he knew to call us when he received a bill, and our client service team quickly stepped in to help him straighten it out and get all the bills sent to the right place so they could be paid appropriately. These innocent mistakes constantly happen to Medicare beneficiaries who sometimes pay unnecessary bills out of simple confusion or not knowing who to turn to. But we here at Boomer Benefits know how to fix them. Let's look at a few other common Medicare mistakes you might run into. Many people today delay their Social Security income benefits because they are still working and they have income, or they're waiting until full retirement age to claim their benefits. Since Medicare can't deduct your Part B premiums from your Social Security check if you aren't taking Social Security, they will automatically send you a quarterly invoice in the mail instead. With the amount of mail that Medicare beneficiaries get every day from insurance companies, it can be very easy to overlook this bill. Unfortunately, the result of not paying this bill is catastrophic. Social Security will revoke your Medicare Part B for non-payment and then notify your Medigap or Medicare Advantage carrier, who will promptly cancel your coverage. Now you're left with no coverage for outpatient services, which includes doctor visits and lab work, medical equipment, surgeries, chemotherapy, and many other expensive services. What's worse is that you would have to wait until the next general enrollment period to re-enroll, and that runs from January 1st to March 31st each year. Though you can enroll in Part B during this period, your coverage won't start until the following month. So let's think about this. If you failed to pay your bill in April, you would wait 8 months to reapply for Part B in January, and then that new Part B coverage wouldn't start yet for another month. That would be 9 months without coverage for anything except for your Medicare Part A hospital-related services. A serious illness or injury during this uncovered time could result in thousands of dollars of unpaid medical expenses, and we want you to avoid that at all costs. So here's our Boomer tip. If you enroll in Part B before you begin taking Social Security, consider signing up for Medicare Easy Pay. Anyone who gets a bill for their Medicare premiums can sign up for this free automatic payment option that allows Medicare to simply deduct your Part B premiums from your checking account each month. This is the easiest way to make sure that you don't overlook paying your Part B premium and causing yourself a world of hurt. I included a link for you below that will take you straight to the page where you can find the authorization agreement that you'll need to complete and mail off to Social Security or Railroad Retirement Board for railroad retirees. If you worked past age 65 and now have retired and transitioned over to Medicare as your primary insurance, you should make a quick call to Medicare to confirm that they now show that they're your primary coverage. This one simple phone call can prevent denials and hassles for you down the road. In a perfect world, your former employer would immediately notify Medicare that you are no longer working, and then Medicare would already know that you now expect them to pay primary, and they'll begin to pay primary just like they should. However, it doesn't always happen that way, and when it doesn't, Medicare could deny all of your new claims because they still show that your employer is your primary insurance in the system. So here's our Boomer tip. Make a quick phone call to 1-800-MEDICARE and get connected with the Benefits Coordination and Recovery Center after you've left your employer to verify that they now show Medicare as your primary insurance. It takes just a few minutes, but it's well worth it if you can prevent an error in your claims billing. Not knowing which ID card to use can cause several versions of easy Medicare mistakes. If you've chosen Medicare as your primary coverage, then you'll present your original red, white, and blue Medicare card along with your Medigap card to your provider at the time of service. If you enrolled in a Medicare Advantage plan, though, that plan pays instead of Medicare. Some people don't realize this, and they give their healthcare providers their Medicare card by mistake. The provider then bills original Medicare, and what does Medicare do? Promptly deny all of those claims because those bills should have gone to your Medicare Advantage carrier. I've also seen this one where a Medicare beneficiary is rushed to the hospital. His or her spouse digs through their wallet, pulls out the Medicare card, and gives it to the person at the hospital. The hospital then sends all the bills to Medicare because they assume the spouse is presenting the correct insurance. This mistake is particularly awful because treatment in the hospital, of course, can be billed from a variety of different places, such as radiology, anesthesiology, physical therapy, and the hospital itself. Each of these bills then has to be corrected separately, which can take you several hours by phone to straighten out. So our boomer tip is, if you enrolled in a Medicare Advantage plan, put your red, white, and blue Medicare card away in a safe place. You will not be using it unless you later decide to drop your Advantage plan and return to original Medicare. Give your providers only your Medicare Advantage card. The second version of IT card mistakes that we see happen often is that beneficiaries will present their Medicare card for a drug-related expense or vice versa, their Part D card for non-drug-related expenses. This is what happened to our client in the example we discussed at the beginning of this video. Think of your Part D drug card as a pharmacy card that you only use at the pharmacy. So unless you're picking up a retail outpatient prescription, you generally won't be presenting your Part D card for payment. What about things that aren't prescriptions that maybe you were picking up at the pharmacy before you enrolled in Medicare? For example, diabetes test strips and lancets, parts for insulin pumps, CPAP machines, and other medical supplies. These fall under Medicare Part B outpatient coverage. You'll either present your original Medicare card or your Medicare Advantage card if you have an Advantage plan, not your Part D card. I have two boomer tips for you here. One, when picking up your outpatient prescriptions or ordering them via mail order, show them only your Part D card. This card usually has the word RX somewhere on the card, and this is the one that you should present at the pharmacy when purchasing prescriptions. If your Part D plan is built into your Medicare Advantage plan, then of course you would just show that card. Number two, when you need to use Medicare Part B to purchase diabetes supplies or other medical supplies, your local pharmacy may not be the best price. Instead, you should order those from an approved provider that you'll find on Medicare's supplier directory online. These vendors are part of a competitive billing program that is in place to save money for beneficiaries like you. And you can find the link to that directory in the description below as well. Medicare Part B has a deductible of $240 in 2024, and it goes up a little each year. You may run into doctors who want you to pay this deductible upfront to them at the time of service, and we do not recommend that you do this. The proper procedure is for your doctor to see you first and then send the bill to Medicare. Medicare will pay its portion except for the deductible to your provider. Your provider will then bill you for the difference. The doctor's office does not need to collect your deductible at the time of service. It's common for people to have multiple doctor visits in the same week or even the same day. For example, a specialist visit after seeing your primary care provider. Let's say your primary care provider makes you pay your $240 deductible at the time of your visit. When Medicare receives the two bills from both offices, it will apply the deductible to the first claim it processes. If Medicare processes the specialist bill first, it will apply your Part B deductible. Now the specialist will bill you for the $240 that you already paid to your primary care doctor. Now you got to chase down the money you paid to the primary care doctor's office, and the doctor's offices do not like to give you money back. They often will want proof that you've paid this deductible elsewhere, which is a hassle. This can be even worse if your first outpatient service of the year happens as part of a hospital stay. You will have no idea which provider will be the first bill that Medicare processes. Therefore, we advise that you do not pay the hospital deductible until after Medicare has processed the claim. Here's my boomer tip. Tell your doctor that you know a deductible is owed and they can bill you for it. Then when Medicare has paid the claim and sent you its notice that you are responsible for the deductible portion, you can pay the doctor what they are owed. I promise this will help you avoid a monster billing mess if you have two appointments close together early in the year. Wishful thinking on Medicare's preventive care benefit can cost you a bundle. Medicare has several great preventive care benefits that are fully covered for you. Medicare pays them at 100%, including screenings for cardiovascular disease, diabetes, and aneurysms. It also includes standard cancer screenings such as colonoscopy, mammogram, and tests for things like lung cancer. Furthermore, you will have coverage for vaccines each year, a yearly wellness visit, bone mass measurements, and more. You can actually find a complete list of preventive care services on Medicare's website, which is medicare.gov. What the preventive care visit does not include is a $6,000 executive physical from the Cooper Clinic or Mayo Clinic. Your local hospital might offer a great full body exam, complete with stress testing, EKG, nutrition counseling, but Medicare only covers the basics when it comes to your annual wellness visit. So even routine blood work can result in bills that you have responsibility to pay because Medicare will not deem them medically necessary if they are part of a preventive care visit. Anything you have done outside the parameters of the annual wellness visit will likely be on your own dime. Your primary care doctor or the billing office manager will know the proper billing codes for what Medicare covers. Keep in mind also that while certain screenings may be covered, related services may not be. For example, we have seen where a colonoscopy might be covered, but the anesthesiologist services during that exam might be separate, resulting in a bill you didn't expect. So here's your boomer tip. Get your preventive care from your primary care doctor and expect to be billed for anything that is routine lab work. If you seek additional preventive wellness care from another facility, confirm with them beforehand what you will owe. Every year in the fall, we run a series of webinars for our existing clients all about the upcoming annual election period. All of our current policyholders are invited via email ahead of time, and the webinar is in-depth, walking you step by step through everything you should be doing this time of year. We also talk about the annual election period in our private Facebook group, on our blog, and here on our YouTube channel so that followers like you who don't have their policies with us will at least get an essential reminder. The reason we go so far as to provide reminders in every possible format is simple. People forget what they're supposed to do about their plans. Every year, Medicare's annual election period, also sometimes called the fall open enrollment, runs from October 15th to December 7th. This is when you can change your Part D drug plan or Medicare Advantage plan for the upcoming year. The election period exists because the benefits of those plans change from year to year. For example, your premium might be going up or down, or your drug formulary might be changing. Your current carrier will send you a packet in September called the Annual Notice of Change, and you should review this packet thoroughly every year. Unfortunately, all the insurance companies will also market you to death around the same time. And that causes people to throw out their annual notice of change packet mistakenly. Then January rolls around and they go to fill a $300 medication, maybe a brand name med, and they find out it's not covered anymore. And by then, of course, it's too late to change. Reviewing your annual notice of change letter is a critical yearly step for saving money on your Medicare benefits. You can't afford to miss reading about the upcoming changes to your plan. So my boomer tip is set a reminder in your calendar every year for September 30th to sit down with your annual notice of change packet and compare the plan's current benefits with the upcoming benefits for the new year. All of this info will be laid out side by side for you in the packet so you can see a significant premium increase or an important medication dropping from the plan. You can then use the Medicare Plan Finder inside of your mymedicare.gov account to easily plug in your medications and doctors and shop for the best drug or Medicare Advantage plan in your zip code. Of course, if your policy is through Boomer Benefits, you can just call our client services team for help analyzing your plan for the following year. And that is my best boomer tip because we provide free world-class service to all of our policyholders where you turn to us when any of these scenarios occur and we guide you through exactly what to do. While Medicare mistakes do happen, I hope the tips in this video should help you to avoid the most common problems. And I'm curious, have you run into any Medicare mistakes in your Medicare journey? If so, let us know in the comments below.